We'll be looking at various cancer conditions of the thyroid gland. So look at the papillary thyroid cancer, we look at the follicular thyroid cancer, we look at the medullary thyroid cancer, we look at the anaplastic thyroid cancer. So all of them, we look at them. Since they are cancers of the thyroid gland, it's just good for us just put all of them together and look at them again. So the first one is a papillary thyroid cancer. Yeah. So this one is actually the most common type of thyroid cancer. So if you're having 100% of thyroid cancers, about 80 to 85 will be papillary type of thyroid cancers. So they arise from the follicular cells and they're actually well differentiated. Alright. So characteristics. They are slow growing, they are often localized, but may actually spread to the lymph nodes that are in the neck. You can see those lymph nodes in the neck. So they are excellent prognosis, alright, and there's a high survival rate. If you want to treat them, thyroidectomy or radioactive iodine therapy is actually the good thing, right? They are about follicular cancers, right? So I think follicular cancers is what we have here. Yes. So for follicular cancers, they're actually the second most common type. They make about 10 to 15% of thyroid cancers. They usually originate from follicular cells. Characteristics: they are more likely to spread to distant organs like the lungs, the bones, than papillary cancers. You get? Papillary cancers, if they spread at all, just be lymph nodes there. Prognosis is good, but slightly less favorable than the papillary thyroid cancer. Treatment is surgery, right? Then how about medullary thyroid cancer? This one is about 3 to 4% of thyroid cancers. They arise from the parafollicular C cells that usually produce calcitonin. So in this type of cancer, you just already know that our calcitonin levels will usually be shooting high. Okay, calcitonin levels will be shooting high, right? So characteristics can be sporadic or hereditary, associated with genetic conditions like the men too, right? Prognosis depends on the stage of diagnosis. If we discover it early, there's a likelihood that the patient can recover, can be treated. Discover it late, there's a problem. Treatment is surgery. Then how about the anaplastic thyroid cancer? See that, right? Okay. So this one we said that is the rarest form of thyroid cancer, less than 2%, right? But it's actually very aggressive. So there's rapid growth, often diagnosed as an advanced stage with a poor differentiation. Alright, prognosis is poor, and somebody that have this anaplastic thyroid cancer, there's a likelihood that they will live for only the next 6 months. Right? Treatment is multimodal approach, including surgery, you do radiation therapy, chemotherapy, so many things, because you're actually dealing with a deadly guy. Right? So these are the different cancer conditions of the thyroid gland. Different cancer conditions of the thyroid gland.